Hello, everyone. Good afternoon. This is Edwin Rodriguez, your health insurance representative. Today, I'm making a quick video to talk about the changes for the Part D drug plans for 2025. You may have heard already that there are some changes going on related to your program. At the end of the year, every year, at the end of September, you should be receiving or should have received what we call an annual notice of change. And what that is a document that tells you what's going on with your current plan for 2024 and what that's going to look like for the following year in 2025. The question I've been receiving a lot lately is for my clients with Advantage plans. Now, because of these improvements to the drug plan for next year, what's happening is the money has to come from somewhere. Well, let me take a step back by explaining what those changes are. So, new for 2025, starting in 2025, we're going to have an annual limit of $2,000. Now, that's not a limit as far as what the insurance companies spend. That's an annual limit for you. That's considered a safety net. Let's think of it similar to the medical portion of your policy, where there's that max out of pocket, right? That's the most you're ever going to spend on medical costs. Well, this new limit is the most you're ever going to spend on prescription costs. And this actually applies to everybody on Medicare, whether it's a standalone drug plan or a Medicare Advantage plan that's the medical and the drug policy together. This limit is true. It's a $2,000 maximum for the year. And what that limit is the most that you, the consumer, will be paying out of pocket for your prescription drugs in the calendar year. Okay. So for 2025, there's not going to be the donut hole anymore. For folks who have dealt with this in the past, you know what I'm talking about, where it was a limit as far as how much the insurance company would spend, and then you fall into a gap where then you have to pay a percentage of the prescription drug plan itself. But again, that's not a thing anymore. Starting new in 2025, you're going to have a $2,000 limit as far as what comes out of your pocket for the year. So any out of pocket you're paying for your medications is going to go towards that $2,000 limit. Okay. Once that number is met, then you're done for the year. So any additional medications, prescriptions that you purchase in the calendar year are going to be covered out of zero co-payments. Okay. So that's a new difference for 2025 is that you'll have a $2,000 maximum as far as what comes out of your pocket for prescription medications moving forward. Okay. Now, the important part to this message is really how that affects the rest of your policy. I've been getting a lot of questions from my clients asking me, hey, Edwin, how come I'm getting a hit on my dental benefit in the Advantage plans where it's all in one? So Edwin, how come I'm getting a hit on my dental benefit? Or Edwin, I see that they're decreasing or eliminating the over-the-counter credit, or a lot of factors. There's some watering down this year, let's call it, to some of the frivolous benefits when it comes to the extra bells and whistles that are included with Advantage plans. Now, I'll start by saying this. Back in July, when we first started hearing about these changes going on for the new year, I thought it was going to be a bloodbath. I thought we were going to be having to change a lot of clients, and we'd have to do a lot of updates and making, changes to people's plans. But fortunately, it hasn't come out that way. It seems to be very minimal changes related to the medical policy. So I'm happy to state that most folks, 95% of you guys are going to be just fine staying right where you're at on your current plan. Okay. So you're not going to need to make any changes to your plan. The changes that are taking place is not specific to your carrier. It's across the board. Because of what I just mentioned, the benefits or the improvements to the prescription drug plan for the $2,000 limit, the $2,000 cap as far as what you pay, that money has to come from somewhere. Would you agree, right? So because of that $2,000 limit for the prescription drug plan that's built into your policy, that money had to come out of somewhere. So rather than that money coming out of the benefits or premiums, more importantly, related to the medical portion of your policy, this is actually coming out of, so you have the $2,000 limit as far as how much will be coming out of your pocket for prescription medications. Now, because you do have now that safety net for prescription drugs, that money had to come from somewhere. It's definitely not going to be coming out of the pockets of insurance companies. Let's face it, right? They're not wanting to pay the differences because of legislation, right? And it's definitely not coming out of the pockets of the guys on Wall Street. So, of course, that's naturally going to fall on our laps, the consumers. Because the money is not going to be coming out of the insurance companies' pockets, what they had to do is they had to water down some of the extra benefits built into your policy. So rather than changing the things like your premium or your co-pays for doctors, hospitals, your max out of pockets for medical care, instead of changing that and beating up your plan on those ends, they're doing is they're taking some of that money away from the frivolous benefits when it comes to your plan. When I say frivolous, I'm talking about the dental, some plans a little bit on the vision, some plans on the over-the-counter credit. And I do have a plan where it's actually taking away the gym membership on one of those policies. Rather than taking that money away from the important part of your policy, which is the medical portion, which is why we have insurance, right? And keeping your benefits affordable, what they're doing is they're taking that money out of those extra benefits. So it is watering down some of those extra benefits. Now, this isn't something that's specific to a specific carrier, right? Or special to a specific carrier. It's across the board with every plan that I'm seeing. Most plans are taking a bit of a hit on those ancillary benefits, let's call it. So with that said, yes, there's been some negative changes, let's call it, to the medical portion of the policies, or really to the Advantage plans in certain aspects. But overall, as you'll be able to see with your annual notice of change, it's actually going to highlight those changes for you, and you'll see that there's really not much going on for next year as far as negative changes overall. So I'd say if you're happy with your plan overall, and you don't have any reason to make a change other than these small changes in the tiny benefits here, I'd say you'd be happy with your plan again for the new year. The benefits that are out there for 2025 are still very strong, looking very similar to how 2024 did. Again, with exceptions with a few carriers, but overall, most carriers, most companies are staying relatively comparable. I'll be emailing folks individually. You may have received emails from me as well individually about some changes that are available to you, or some plans that actually require action for the new year. But if this is the only email you're receiving, then this is a good news. Your plan is staying relatively comparable for 2025. No action needed. But if there are any changes necessary, as a reminder, we have all the way until March 31st of 2025 to make any final changes for folks who are on an Advantage plan. So people with the Medicare Advantage Part C, or it's the medical and the drug coverage in one policy. So again, if you're happy with your plan overall, no action is needed. Just review those changes that are going on for the new year with your annual notice of change, and that will highlight what's taking place for 2025. Again, for the frivolous benefits or the ancillary benefits that are built into the policy, most carriers, most companies are taking a bit of a hit on that. And the purpose of that is, again, is to save the important part of your policy, which is the medical portion of your policy, while they're improving the drug portion of your policy. So just to recap again, for 2025, we are going to have a $2,000 annual maximum as far as what you, the consumer, will be spending on prescription drugs. So that's a good benefit. That's an improvement to the prescription drug coverage for everyone, okay? Now, because of that improvement, the money had to come from somewhere. So clients with standalone drug plans, you might have seen some premium increases, possibly even some deductibles to your plan. But as a reminder on that, you're still looking at 2,000 as your cap, okay? 2,000 is going to be the cap as far as what you spend on your medications. That includes your prescription deductible as well as any out-of-pockets for the year. So even though your cost may seem to have gone up, remember your $2,000 is the most you're ever going to spend in the year for your prescription drugs. For my Advantage plan clients, that $2,000 is a benefit for everybody on those policies as well. So you're never going to spend more than $2,000 in the year for your medication. Now, because again of that improvement, they had to take that money from somewhere rather than it coming in the form of premiums to your policy or increased co-payments and costs related to your plan, like hospitalizations, max out of pockets, things like that. They didn't touch for most plans. They didn't touch that. What they did is they just kind of watered down some of those extra benefits. I hope this information was helpful with explaining why you might be seeing some changes for 2025 related to your program overall. But overall, I do believe that these changes are positive changes, despite it taking little nibbles out of our coverage from how we knew it to be. And to add to that as well, I've been in this business now going on 17 years, or going on 18 years actually. 18 years now in this business, and I've always seen that these plans go like this, right? Every year or every 3 to 5 years, the plans get better, they get worse, they get better, they get worse, right? As far as cost and out of pocket. So this is nothing new. Over time, I'm sure we'll see these plans improve again. But I'm happy to note that for 2025, overall, most of these plans are going to stay relatively comparable as far as the medical benefits built into the policy, with improvements to the drug plan as well. So again, I do hope this information found you well and that this information is helpful. Obviously, if you have any questions, please let me know. If you do require any additional consultation, I'll include a link in the description below for a link to my calendar in the email in which this came as well. For those who receive this message via email, there will be a link in there for my calendar too, if you do have any additional questions. But again, I hope this email does answer the question for you. I've been getting the question so many times about these changes. I figured it might make more sense to and be more concise with sending this message out in a group setting. So again, I hope this information helps. I wish everybody a safe, great rest of the week, great rest of the year as well. If we don't speak to you again by the end of December, then I do look forward to talking again in the new year, okay? Hope all is well and look forward to speaking to you soon. All the best.